There's nothing either good or bad, but thinking makes it so. This Phase 3 multicenter cluster randomized trial evaluated whether pre-hospital transfusion with whole blood offers benefits over components in reducing mortality from traumatic hemorrhage and shock. Conducted across 44 air medical bases, the study included a total population of 1,020 eligible trauma patients. These patients were randomly assigned in a 2-to-1 ratio to receive either up to 2 units of whole blood or tailored components like plasma and red cells. The primary endpoint was mortality from any cause within 30 days after randomization.
Quick take. This study aimed to determine if whole blood transfusion in trauma patients reduces mortality more effectively than blood components, focusing on 30-day mortality rates post-randomization.
The primary analysis included 695 patients receiving whole blood and 298 receiving components, with mortality rates at 30 days recorded at 25.9% and 20.5% respectively, yielding an adjusted odds ratio of 1.24. Adverse events did not differ significantly between groups. A sub-study found mortality rates of 27.1% for patients receiving whole blood stored for 15 to 21 days versus 26.4% for those stored 1 to 14 days. The authors conclude that pre-hospital use of whole blood did not lower 30-day mortality compared to blood components in trauma patients with hemorrhagic shock.
Quick take. The study concluded that pre-hospital whole blood transfusions did not significantly impact 30-day mortality compared to blood components in trauma patients.
Short quiz, clinical vignette. Question. A 35-year-old male with traumatic hemorrhagic shock is transported by Air Medical Services. His laboratory findings indicate severe anemia. Based on the study findings, what is the likelihood that pre-hospital whole blood transfusion will reduce his 30-day mortality compared to component therapy? Option A is significantly likely to reduce mortality. Option B is likely to reduce mortality. Option C is no difference in mortality reduction. Option D is likely to increase mortality.
The answer is option C. The trial found no significant difference in 30-day mortality rates between pre-hospital use of whole blood and blood components, indicating no additional mortality reduction.